What's the difference between a nurse practitioner and a physician assistant? Honestly, not much. The care we provide, the jobs you can apply for, what employers are looking for, our salaries, our day to day responsibilities, they're going to be very similar. In my practice, most patients don't even know if I'm an NP or a PA, and honestly, they don't care. They care that I listen to them, diagnose their problems, and help them get better. I've even had coworkers mix up my title because it simply hasn't mattered at all in our day to day work. Now, if you're trying to decide which career path is right for you, then there are a few differences that are worth knowing. The biggest one is the educational pathway. To become a nurse practitioner, you first become a registered nurse and then complete your NP program. One advantage of doing this is that many nurses can continue to work as an RN while doing their NP program. To become a PA, you typically complete a bachelor's degree, you get some healthcare experience, and then you attend an intensive full time PA program that's usually shorter but can make working during school more difficult. Some other differences worth mentioning: both nurse practitioners and physician assistants can prescribe medications and obtain their own DEA license. However, PAs have to prescribe controlled substances under their supervising physician, while nurse practitioners do it under their own DEA. Another difference is practice independence. Depending on the state, some nurse practitioners can get an autonomous license. For example, here in Florida, after meeting a lot of requirements that include 3,000 hours of supervised clinical practice, certain nurse practitioners can apply for an autonomous practice and even open up their own primary care practices without physician supervision. Now, PAs generally continue to practice with a physician led model. Now, if you're interested in surgery, PA programs typically include training geared towards your first assisting in the operating room. Nurse practitioners like me can absolutely work in the OR and first assist, but many will have to obtain additional training after graduation. So, if you're a nurse interested in becoming a surgical NP like I did, I'd strongly recommend getting some OR experience as an RN while working on your NP. So, my advice: if you're already a nurse, go for your NP. You're already halfway there. If you need to work while advancing your education, NP might also be the best fit. Otherwise, both are excellent careers, and for most people, either path can lead to the same destination.